Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune, and today I'm going to tell you everything that you need to know about the GGT test, which is also called the Gamma-Glutamyl Transferase test. It's a simple blood test that measures an enzyme that is present in your liver. Let's go. So what is the GGT test? Well, this, as I've already said, it is a blood test in which we measure the level of gamma-glutamyl transferase. This is an enzyme which is basically a tiny little chemical which is present mainly in your liver and also in your bile ducts. The bile ducts are basically a system of tubes which connect your liver directly to your intestine inside your stomach. So this is it's basically an enzyme which has certain functions in your liver. It's usually measured to check whether your liver is under any kind of damage, any kind of strain, and the number one reason because of which its level goes up is because of drinking too much or chronic alcoholism. So what are some symptoms that may have prompted your doctor to get you to do this GGT test, or some things that you might have noticed yourself? So the most common ones are yellowing of the eyes or the skin. This is called jaundice. A sign that there's something wrong with your liver or your gallbladder. Second is stomach pain and swelling around the right side of the stomach. This could be something wrong with your liver. Third is your urine has turned dark and your stools have become very pale white in color. This also points to a problem with the liver or the gallbladder. The fourth is a loss of appetite. You don't feel like eating. This could sometimes also be accompanied with itching on the skin, again all pointing to problems in the liver. There are also other conditions that could arise later on in case of liver damage, but these are the main symptoms that you need to be aware of. So what are some diseases that could cause your GGT level to rise? I mean, what are the conditions that you need to know about? So the first one is hepatitis, swelling of the liver, inflammation of the liver, either because of a viral infection or because of drinking too much or because you are overweight, which is also called fatty liver. All these are causes in which your GGT level could rise. The second is problems with your bile ducts. These are small little tubes that connect your liver to your intestine. Sometimes they get choked, they get obstructed, just like the plumbing in your house, and that can cause inflammation all throughout the tube and cause your GGT level to rise. Other than this, of course, chronic alcohol use disorder, drinking too much, drinking too many times in a week will definitely damage your liver and cause your GGT levels to rise. Cirrhosis, which is basically the last stage of liver damage, definitely will cause your liver and your GGT levels to rise. And fatty liver disease, which is basically a condition in which a lot of fat gets deposited in your liver because you're eating too much, you're overweight or you're obese. All these things will damage your liver and cause your GGT levels to rise. How is the GGT test done? This is a simple blood test. They will insert a needle into the vein in your arm, draw 3 to 5 ml of blood and test it in the lab. You will usually have the reports on the same day. Most labs will not ask you to be fasting before this test, but some might ask you to be fasting for 8 to 12 hours, as it can make the slight changes in the results. But by and large, this is a simple blood test, no special preparations, and results on the same day. What are the normal ranges of the GGT test in adults? In men, the normal range is between 9 to 48 units per liter. In women, it's somewhere between 7 to 32 units per liter. And in children, the values are higher. In newborns, the values are higher, but they come down with age. So what does your GGT test report really mean? What are the causes because of which the GGT levels might be high? In the most of the people, the most common cause is alcohol. Drinking too much for too many years will definitely raise your GGT level. After that, we have problems with the bile duct or the gallbladder, gallstones, choked up gallbladders, very common cause. After this, we have patients who have chronic heart disease. Heart problems can also cause the GGT level to rise. Together with this, people with diabetes may also show a rise in the GGT level, and also those with some kind of problem in their pancreas. Liver swelling and hepatitis, very common cause. And last but not the least, if you're on some kind of medications which you're taking for a very long time, there are many medicines which will damage the liver and raise the GGT level as well. So you need to talk to your doctor about that. These are the possible reasons why your GGT level may have shot up. What is the cost of the GGT blood test in India? The cost in our lab in Pune is around 130 rupees. We usually club it together with the rest of the liver function tests, and together that costs somewhere around 1000 rupees. What is the cost of the GGT blood test in India? What are some foods that you can have to naturally protect your liver, to naturally improve your GGT levels? Well, fruits and vegetables rich in antioxidants are always a go-to to reduce your GGT levels. Along with this, you must avoid red meat, fried foods, processed foods, high sugary foods. Avoid all that. Cut down completely on your drinking. Reduce oil in your diet. Try to adopt a Mediterranean diet and go for green leafy vegetables. All this will help your GGT level.